Hello, Jennifer. Welcome to Owen Healthcare. How are you today?
Hi, I'm good. How are you?
I'm fine, thank you. Can you please have a seat?
Yeah.
Before we start, can you please confirm me your full name, date of birth, and contact information?
Yeah, my name is Jennifer Allen Doe. My birthday is 1199 and my phone is 321-321-3333.
Thank you so much for providing me this information. It's very accurate, which I have in my file. Before we continue, I would like to go over the confidentiality statement.
Okay.
Everything that we talk today or discuss, we're gonna keep on confidentiality. But if you just hear something about harm yourself or someone else, it's something that I need to discuss with my management. That is make sense for you?
That makes sense.
Okay. You would like to introduce yourself first?
Um, yeah, I was just referred here by my husband and my doctor. So I've been having some issues with intrusive thoughts.
Okay. I know it is hard to trust to someone at the first time, but please be more honest you can and feel comfortable. Can you please tell me what's bringing you here today?
Yeah, my doctor told me to come here after my physical, which was a week ago. I've been described as hyperfixated on unimportant tasks. Some of my friends have said that to me. My husband brings up that I check and recheck locks, and I'm cleaning the carpet and bleaching the kitchen every day.
Do you know when this start?
I guess I've always been a neat freak since I was young, but with different items. I started concentrating on those specific things after we'd moved into our house.
How frequently do you feel these symptoms?
They would be every day, and that's why my doctor told me to come here.
Do you think this is impact your daily basis?
Yeah, I've been late to work multiple times because I get caught up in my chores and time gets away. I've also caught myself yelling at my husband when he steps on the carpet or the kitchen floor. And I've noticed that my breathing's been impacted, but I can't stop cleaning.
Okay, I realize how hard it's maybe to live with this person if you everything is clear, the house is closed, living with a fear if it's someone's come to your house and ring your carpet, having to give up your job because the pressures of your housekeeping and safety. But there is no problems that cannot be solved. We will work together to reduce the symptoms and you can live a more peaceful life. Can you please tell me about your childhood experience?
Yeah, I grew up as a pretty normal child. I did have a slight tick, so the kids would bully me at school, and I would always tell my teacher if that happened. Other than that, I like to draw, sing, and read. I grew up with my family, with my one sibling, and we would just hang out and do activities together.
Can you tell me how do you feel when you experience those bullying from your friends?
I would kind of become socially withdrawn eventually. I would sometimes speak up for myself, but usually I would go tell the teacher.
Okay, did you participate in any counseling because of that into school?
I did a little bit for about 6 months. It was pretty good.
Okay, sounds good. How many siblings you have?
I just have my one sibling. He's 3 years younger than me.
Okay, how is your relationships with them?
We get along pretty well. Also, with my parents, we get along. They have the same working schedule, so we'd find times to hang out. But I do prefer indoor activities rather than outdoor.
Okay, can you tell me or talk me a little about your parents?
Yeah, my mom's an accountant, my dad's a lawyer, and like I said, they have the same work routine. So they kind of like hiking and biking more than I do. That's kind of what they mainly drift towards.
Do you remember to experience like your parents experience the same symptoms that you're experiencing today?
My mom has some anxiety, but other than that, they haven't.
Everything's fine.
Okay.
How do you describe your daily routine? Let's say your free time, self-care, your I mean, if you after working.
Yeah, I'd say I get up. I always have coffee in the morning, but then I end up noticing the coffee grounds on the counter and I go to pick it up. And the kitchen is right beside the living room. So then I end up going to clean up the carpet because I noticed the fibers aren't exactly even and I see all this dust around me. I keep getting headaches, and then my mind keeps saying I have to clean a little bit more because everything's out of place. So I always have headaches in the morning and the time gets away from me. And like I said, the cleaner has been affecting my throat and my voice. When I finally get to work, they get annoyed that I'm late. And other than that, I just help with transferring documents onto the online system.
Okay, okay, sounds good. Um, I know that you mentioned that you like to readings and writings. Do you have any problem with that sometimes?
No, it's one of my favorite hobbies.
Okay, sounds good. Have you ever been in counseling before?
Yes, I was in counseling for a couple years, for depression, but they changed my insurance plan. I liked it overall.
Do you experience any distress at this moment?
Not at the moment, no.
No? Okay. If I need to contact the providers or your counseling before, can I do?
Yeah,
Okay. I will ask my assistant, she's the front desk, to take the information from them to see if I need any informations about your records. Okay? All right, thank you. Um, have you been psychiatric treatment before?
no.
No, sounds good. How is your sleeping routine?
I eventually get to sleep around midnight and wake up at 7. Like I said, I usually am a little bit more tired and the day gets away from me while I clean, and then I go to sleep pretty late.
Okay. How do you describe your appetites?
My appetite is normal.
Okay. Do you have your 3 meals during the day, a snack, something like that? Really well?
Yeah, 3
Okay.
meals and a snack at night.
Okay. Do you have any distractions at this moment?
If I get distracted, it's because I'm not cleaning, and then once I clean, I get hyperfixated.
Okay. Do you feel worried or preoccupied sometimes, or your family is preoccupied about yourself, what's going happen with you at this moment? Or
Yeah, my husband and mom are really concerned. I do have worrying thoughts. They take up a lot of my time, and I know other people aren't living this way, but I'm too nervous to tell them. And I know that the thoughts aren't good, but I can't control it.
okay, are you feel very tired at this moment? I know that you're going through with the cleaning house, manage your time with your work times. Like if you have any activity out of your house, how do you feel any tired?
I do a little
Okay.
bit.
It's really hard to manage your time at this moment, right?
It can be, yeah.
Okay. Do you feel that you have a good support?
Yeah, my husband and my mom are good supports for me. They'll try to distract me with activities, and sometimes that'll work.
Do you think that your husband help you with the cleaning at home?
Yeah, he'll help me, but I have to clean the living room and the kitchen.
Have you ever felt lonely or insulated?
I wish I could hang out more with my friends. I've had to cancel a couple times, but I do text everybody.
Okay. Do you experience any impulsive actions or behave?
Yeah, the thoughts that I have, it keeps telling me to clean, and then I feel a little bit better after, but then I see everything else I need to clean, and the thoughts come back.
Okay. I think I mentioned that you hear some voices sometimes, like cleaning your house, clean the carpets. Do you feel any hallucinations or paranoias or manias during your daily basis?
I'm a little paranoid that I'll get sick if I don't clean every day, but I know that my thoughts aren't exactly right.
Okay. Do you have any cops how to deal with this?
No,
No. Okay. Do you have any preoccupies about to have a sex?
no.
Okay. How you socialize with others?
I usually text them and then we'll go to hang out. I have canceled the last 3 meetups because of cleaning in the past year.
Okay. Do you feel any angers or experience aggression before?
I find myself getting really annoyed and angry with anybody that shows up randomly at my house. Other than that, I just get a little perturbed about regular things like losing my keys.
Okay. Is there any social phobia before or at this moment that you experienced or something that you can remember?
I'm nervous that my friends will want to come to my house or get mad at me for nagging. They've said that before to me when I was explaining why I was late.
Okay, okay. Um, do you use any drugs?
No,
Do you drink alcohol or something like that?
no,
Okay. Have you ever attended to support groups? If you eat, if you attended, it was helpful?
I haven't attended any.
Okay. You would like to enjoy any groups?
Yeah, if there's any online groups.
Okay, okay, understand. Have you ever tried to harm yourself before?
No, sometimes I wish I were born different, just because I know that the daily cleaning is not how most everybody is experiencing their life. Um, I'm just really scared somebody's gonna show up and wreck my place, but I don't want people to find out. I'm not suicidal.
Okay, okay, sounds good. Do you have any physical problems at this moment?
No.
When was your last physical?
A week ago, they said my throat looked irritated, and then that's when I told them about the cleaning, and they told me to come here.
Okay, if I need to talk with your primary doctor, can I do as well?
Yeah, his number is 321-333-3334.
Okay, do you experience any trauma in your childhood? Like if you remember anything that impact your life when you was child?
No.
Okay. Any family medical history?
My grandfather has skin cancer.
But he's alive?
Mhm.
Okay. Any family mental problems at this moment or before?
My mom has anxiety and my brother has ADHD.
Your mom is on therapy or she's taking any medication?
Yeah,
Yes.
she's not on medication, but she's in therapy.
Okay. Did she talk to you about the therapy? How is work with her?
Yeah, she said that this would be a good place as well.
Okay. Is there any additions in the family?
No.
All right. After listening to all your symptoms, and I can understand what you experience is a mental disorder known as an obsessive compulsive disorder. Is the long-lasting disorders in which a person experiences uncomfortable and recurring thoughts or associations, let's put in this way, like your cleanings, checking the door like several times to make sure that it's closed. So is that an engaged in repetitive behavior, compulsions, or both? People with OCD have times consuming symptoms that can cause significant distress of interference with your daily life. I would like to recommend you to attend with one of my APNs for a psychiatrist examination to determine whether you require medication or not for help with your anxiety
Okay.
and recheck if you have experienced any disperse at this moment. That I think this is not a big problem at this moment with you. I think it's the OCD symptoms that can is very impact your life at this moment as well. 13 weeks of individualization with me, so where we can engage with therapy known as a CBT, a connected behavioral therapist, that will be very helpful